Throughout the year, we'll be highlighting programs and efforts by MCSO staff that embody these initiatives. This month, I want to share with you one such example, the Navigator program, an innovative and collaborative project that directly impacts public safety by helping to create better systems alignment in an effort to break the cycle of recidivism in our jails. Realizing that a sizable number of adults in custody for low-level crimes such as trespass, disorderly conduct, and drug possession are driven by addiction or mental health issues, MCSO worked closely with the District Attorney's Office and local service providers to develop a pilot project based on the concept that connecting those needing services directly to providers will likely lead to better outcomes than a traditional approach in the criminal justice system.
Our team, specifically Law Enforcement Assisted Diversion, or LEAD, works currently with the Portland Police Bureau, but also now expanding to the Sheriff's Department to give officers and deputies an alternative option rather than sending people to jail for small, low-level drug offenses, getting people connected to resources to keep them out of the criminal justice system and give them an opportunity to build their lives back together.
The program is currently in operation during day shift at the detention center and is staffed by our Social Service Navigator, Laura Malmstrom, under the direction of Lieutenant Steve Reardon. Here's how it works. All adults in custody who are about to be released on their own recognizance are engaged by the Navigator, who requests an interview to determine whether or not the person is in need of services.
When I interview an adult in custody, I start by asking them questions to try to get at what their real needs are to help them be successful. Some of that is whether or not they have a mental health diagnosis, they're homeless, they were a veteran, if they're a transitional aged youth. That way, at the end, I can match them with the best provider possible to meet their needs.
When the Navigator makes a referral, arrangements are made to assist the person in connecting with the service provider. Nearly 50% of the interviews currently result in a referral.
So once I make a referral for a client, I give them a flyer for the agency that includes the address and the bus lines that they would need to get there. And I either give them a bus ticket or can call a taxi for them based on their preference so they can actually directly connect to the agency that I'm referring them to.
Once the person engages with a provider, appropriate services are offered to help them address their personal needs.
They get assigned a case manager who completes an assessment with them, and we use that assessment to collaborate with the person referred to us to figure out where the opportunities are to help them, whether that's getting connected to housing, getting connected to treatment, basically anything that could possibly support them.
Phase 2 planning for the program has already begun, with additional enhancements soon expected to be put into action.
So the next phase of the Navigator, we're going to be bringing in additional resources for the adults in custody. We're really excited because this gives us the opportunity to also bring in peers that have been through the system before that will be transporting the individual upon release to that provider.
And finally, the District Attorney's Office will make an independent decision on whether or not to proceed with prosecution based on the level of the person's positive engagement with the provider. To measure the effectiveness of the program, MCSO's Planning and Research Unit is tracking each step of the process. This is an important project, and bringing it all together was truly a team effort. In addition to our systems partners at the District Attorney's Office, CODA, Cascadia Behavioral Health Care, and Central City Concern, I want to thank all of the MCSO staff that helped to develop the Navigator program and support its operation.